Good morning, Dr. Acree. How are you today?
I'm great. How are you?
I'm doing well. My name is Tanika. I'm a student at the University of Charleston School of Pharmacy, class of 2019. And I'm doing this interview for our class, Pharmacy Law, to get some information pertaining to your area of practice and how you chose that area of specialty.
Sounds great.
Okay, let's begin. Dr. Acree, what led you to pursue a career in pharmacy and why academia?
Well, in pharmacy, I decided to go into pharmacy when I was a little bit later. So I was 27 when I actually finally decided on pharmacy. I started out as a photography major and kind of moved around a little bit, and then I became pregnant with my first son and decided to buckle down and do something that I actually loved and enjoyed, and so that's where I kind of settled on pharmacy. I've always been interested in the healthcare field, and pharmacy seemed like a really good fit for me.
Interesting. I also understand that you're a consultant pharmacist. Is that correct?
Sort of. I work with the city of Charleston, so I help their patients as well. So it's kind of one of my practice sites. So basically with those patients, I work with patients with diabetes, patients with high blood pressure, basically anything that could benefit from the advice and counseling of a pharmacist.
Okay, and how did you arrive at that? Would it be the same as the...
Yeah, when I went into academia, I decided during my fourth year that I loved academia. So I did a rotation in academia, and I actually got to teach a little bit, got to write test questions, and I fell in love with it. So working during my residency, I actually kind of started working in this clinic, and then the professor that was over the clinic decided to leave UC, so I kind of slid right in, and that's kind of how I ended up with the city of Charleston, because I started doing it as a resident.
Oh, well, good. That worked out for you.
Mm-hmm.
Okay. Dr. Acree, what subjects did you find most helpful when you were in pharmacy school?
Well, at the beginning, I loved pharmaceutics. So I started out, before pharmacy school, I started out working in a compounding pharmacy. So I really enjoyed that part of it. And pharmaceutics kind of tied into that. So I love the math. I love every part of pharmaceutics. So I really enjoyed that class. And for anyone that would be working in a compounding pharmacy or doing any kind of pharmacy where they would need those kind of skills, which really in basically all types of pharmacy you need those skills. I think that's a really beneficial class. And then kind of going a little bit further, pharmacotherapy was absolutely my favorite course while I was here, because you could actually take everything that you learned the first year and a half, 2 years, and kind of put it all together and actually be able to apply it to a patient. So I thought that was extremely beneficial.
Okay. What steps have you taken to reach your current position? Was there a residency or further education required?
Absolutely. So during my fourth year, like I said, I really enjoyed my rotation in academia. I also really enjoyed my rotations in ambulatory care. So that's kind of realized during my fourth year everything that I wanted to do. But I knew that if I wanted to do academia, and I knew that if I wanted to do ambulatory care, that it was going to be, I needed to do a residency. I looked around, I chose a few that I was interested in. UC was the one that I really, really wanted, and that's the one that I ended up with. So I was really, really happy about that.
And I guess you somewhat answered my follow-up question. What exactly did you gain from the experience to apply to what you're doing right now?
Well, absolutely learned a lot more about teaching. So the UC residency is extremely heavy in teaching. I taught about six didactic hours my first semester and about 6 the second semester. So I got plenty of teaching experience out of my residency. I got to work in several ambulatory care clinics, got to meet up with a lot of patients, and some of the patients that I have now in this clinic actually started with me during my residency. So it's flowed well through the whole process.
Okay. So who exactly would you recommend your specific field of pharmacy to?
Since it's ambulatory care, I spend a lot of time with individual patients. So I sit with a patient for 30 minutes to an hour discussing their disease state, talking about the drugs that they're on, all those kind of things. So definitely somebody that's more patient oriented, someone that would be more research oriented. I don't I wouldn't recommend this particular field. Academia, yes, because you do get to do a lot of research within academia, but not specifically ambulatory care. I think someone that is more patient specific, they want that time to sit down and talk with a patient. That's the kind of person that would need to be in this particular field.
Okay, great advice. Thank you.
You're welcome.
All right. Dr. Acree, if you could redo all your career decisions you have made since deciding on your current path in pharmacy, would you make a change and why?
I would definitely not make a change. I love what I do. It's my dream job. I get to see patients. I love all of my patients. I love all of my students. I get to teach. I'm doing exactly what I want to do, and things just kind of fell into place with everything that I've done, all the decisions that I've made through pharmacy school and residency. So I'm happy with what I'm doing.
Okay, great. Since you would make a change, is there something in your current practice that you would like to make a change to or see improve through maybe the courses taught in school or even through legislation?
I really think that, especially here, we tend to change things as needed. So the courses that we teach, we make the changes necessary. So if we see that there's any kind of issue with student learning, or if we feel that students aren't getting everything that they need, we make that change immediately. We don't wait until 4 years go by and we see how they do on the NAPLEX or anything like that. We make that change as soon as we see that there's a need. So I really feel that academically, I think that we do really well here at UC. With legislation, of course, we want to keep expanding the practice of pharmacy, allowing us to do more things, see more patients, bill for more services, so actually be considered a provider, those kind of things. Those are the things that I would like to see change. But when it comes to the courses here, I think everything's great. So.
Okay. What has been the biggest change in pharmacy since you began your career?
Well, the scope of practice, so what we can do as pharmacists, especially with immunizations, that's been huge. I actually, when I was going through pharmacy school, I hated needles, and so I said, I'm never working for any place that makes me give shots. But once I got into my residency and I became licensed as an immunizer, I actually really enjoy it because I'm doing something for the community. Since then, I've been able to go into daycares and immunize the workers there. I can't immunize the children, but I can go in and at least provide immunity on that side of things. So especially with pertussis and the flu vaccines and things like that, I'm going in and actually making a difference. So that's been the biggest change that I've seen since starting pharmacy.
While practicing, when have you had to make a critical decision? And if so, what was the outcome of that decision?
Well, I make decisions every day, and I never know what is going to be critical, what's not going to be when you look at the whole scheme of things with a patient. So every decision that you make in their care can be huge for them. So I can't think of a specific example, but basically I try to think of every decision as a critical decision when I'm talking to patients, and I try to do anything I can that's best for them. Whether I put them before myself, so whether I agree with what they're doing or whatever it may be, I try to make it as patient specific as possible so that they are gaining the benefit from whatever decisions that I make.
I agree. Due to the commitment required to be a student pharmacist, what strategies do you suggest for balancing our student and personal lives?
Well, you always have to look at your priorities. So you have to think pharmacy school first. But you also have to have playtime. So if you study constantly, you will get very tired of doing that, and you'll get burned out and you'll get miserable. So the best thing I can suggest is you take your study time and you take breaks and you do something fun so that you don't get stressed out, you don't get burned out in pharmacy school. Take your breaks. If you have a family here, make sure you spend time with your family. Do not neglect your family because of pharmacy school. If you have to lose sleep but so that you can stay awake and study at night but spend time with your family during the day, those are the sacrifices that you have to make. So for me, it was pharmacy school, but I also had a family, so I would basically try to spend time with my family, be focused on them for a few hours every evening. And then I would focus on my studies. But I never let my studies fall behind because I knew that was something that I absolutely had to do, not only for me, but for my family as well. So You just kind of have to balance it the best you can, but don't spend all your time studying. And that's probably not what you expected to hear. You do need to study quite a lot, but you have to come up with a good plan.
A good balancing act.
Yes.
What is the most important piece of advice you would give a P1 student?
Do not study like you studied in undergrad. You can't cram for anything in pharmacy. You get too much information for every single exam. So you can't just stay up all night and study for one exam. You will never even get through the material. So every day, go home, spend an hour or two looking through the material that you learned that day. Even if it's just flipping through the slides or going back and listening to a lecture, make sure you're doing something every single day. Like I said before, don't study all day, every day, and not have time for yourself, but you need to take at least a couple hours a day to go over everything. And if you can keep up with everything, then when it comes time for the exam, all you're doing is refreshing that information. A lot of times students get in trouble in their P1 year because they try to study like they did in undergrad. So they wait till 2 days before an exam, and then they try to go through all the slides, and they don't even get through everything, or they get everything confused. So just try to partition it out, little bits here, and then at the end, you're not trying to cram it all in.
Okay.
You're good.
For you, what was your defining moment as a pharmacist?
Well, I've had a few. So the big one is having a patient that he's diabetic and he has been uncontrolled for years and years. And I started seeing him when I was a student. So I saw him on rotation during my 4th year, and he's still my patient now. But in that time, I mean, he has made huge strides. So with the work of me helping him, plus his primary care physician helping him, I mean, he's actually almost to the point of being controlled. And that's huge for him because he's always been so uncontrolled. So that was huge for me. Another point was I had a patient come to me, and she came to me for help with weight loss because her friend had come to me for weight loss. And her friend had already lost like 30 or 40 pounds and was out walking every day, and I made a difference in her life. And she went to her friend and said, hey, you need to go see Dr. Acree because she helped me lose weight. She got me motivated. So that to me was huge because I knew that I actually made a difference in someone's life. So.
Okay. Dr. Acree, on behalf of my classmates and I, we want to thank you for giving us the opportunity to interview you and allowing us to glean and learn from your wealth of knowledge. The information gathered is very informative and will be of help to us as future pharmacists as we embark on the journey of this noble profession of pharmacy. Again, we thank you.
You're welcome.